Learning outcomes. After studying this module, you shall be able to understand the functions of a marital relationship, know about the theoretical approaches to couple counseling, understand the role of a couple counselor, learn about the goals and processes of couple counseling, analyze the application and appropriateness of various intervention techniques as well as the ethics in couple counseling. Introduction. Marriage may be defined as a bond between a man and a woman that organizes the family and allocates respective gender roles in the domestic household. This partnership comes with a set of sanctioned moral and legal codes of adherence. Like any relationship, this long association is also fraught with various challenges around its preservation. Two individuals with distinct set of personalities, values, opinions, interests and lifestyles often face the challenge of running a household, raising a family, developing mutual consensus and resolving conflicts. While encountering moments of crisis are natural, but addressing difficulties and recognizing differences becomes imperative to the progress towards a more compatible and socially mature relationship. Couple counseling is a systematic therapeutic approach that serves to build the gaps in a marital relationship to ensure its longevity and happiness. A marriage counselor can facilitate behaviors in a respectful and collaborative manner. It is also important to note that whereas individual counseling focuses on the crisis of single individual per se, couple counseling falls under the realm of a systematic perspective of a larger context in which one or both partners inevitably belong. Interventions therefore attempt to bring changes in the structure, communication and relational patterns between partners.
Marriage is believed to be a universal social institute that largely performs similar sets of functions across different societies. Getting married is not just a social norm but also fulfills a basic need for love and belongingness. It offers a new mode of sustenance, continuation of lineage and cultural values, as well as serves as an emotional and social support in times of crisis. Spending life with a partner ensures one's gradual and successful progression into more complex life stages like childbirth, responsibilities of middle adulthood, and partnership during old age. Considering the psychological and social implications of couple relationship, marriage also emerges as a social entity that significantly contributes to the shaping of one's sense of identity and well-being. Thus, we observe that it is a combination of personal, social, emotional, as well as cultural needs that marriage serves. Need for couples counseling, marriage, and the changing society. The last century has witnessed profound changes in the functions, character, and stability of marriage by Wilcox and Knock in 2006. While on one hand there is a greater sense of individualism, rise in a woman's social and economic status, as well as the shifting meanings of the traditional nature of family, have collectively contributed to the emerging trends of a more egalitarian marriage system. On the other hand, traditional image of home being a secure and a comfortable place of togetherness has also undergone tremendous change. Marriage comes with a range of new emotional and social encounters. The emotional functions of marriage have become particularly crucial for the stability of the contemporary couple relationship. Numerous researchers working in the direction of positive psychology insist on the benefits of a healthy marriage towards a greater overall happiness and subjective well being. Extensive literature documents higher levels of SWB and life satisfaction among married individuals as compared to the ones who were divorced, separated, or widowed. Being married and having a family is related to several pros from one's life. These include a sense of belongingness, having supportive and stable relationship, fulfillment of intimacy and love needs, as well as financial steadiness. A general benefits view supports the marriage happiness relationship across different cultural diversities. This viewpoint is further justified by several studies that have revealed higher levels of emotional distress and mental illness among those who are unmarried or living alone by Goldswig et al. In 2009, Palner and Mittelmark in 2002. These may include feelings of depression, loneliness, poor physical and mental health, as well as lower lifespan. However, the quality of marriage is an extremely significant predictor of all such descriptions. It is held that, in terms of individual happiness, a bad marriage is worse than no marriage at all by Myers in 1992. Marital and family discord is usually centered on some common concerns like self-fulfillment, child rearing, mutual understanding, monetary pressures, and social responsibilities. With the dramatic changes in women's labor force participation and cultural norms surrounding gender roles since the 1960s, along with men's failure to take up an equal share of household labor, it is not surprising that the division of household labor has emerged as a crucial source of conflict for many contemporary marriages. By Blair and Johnson in 1992, Greenstein in 1996, Hochschild and Matching in 1989. Imbalanced marriages are often accompanied by constant discord, feelings of anger, guilt, and depression, devalued self-concept, lack of support, economic crisis, abuse, alcoholism, and infidelity. Some emergent challenges in the modern day household include career-oriented spouses, single-parent families, and isolation among children, broken homes, and emotional crisis. Younger couples show a decline in the marriage strength and an increase in marriage conflict as compared to the older couples. Moreover, families have begun to include single-parent families, remarried or blended families, multicultural families, childless families, dual career families, aging families, and gay lesbian families by Gladding in 2009. These changing trends definitely build the need and urgency towards a branch of psychological therapy called couple counseling that may be understood as a psychotherapeutic effort aiming to treat relationship distress between two married partners and to improve the adjustment between two people who form a conjugal unit. In India, marriages are considered a sacrosanct union between two families. According to the Hindu Vedas, marriage is essential for performing one's spiritual duties and religious ceremonies. It is considered a union of soul, mind, and body for all lives to come by Sharma Pandit, Pathak, and Sharma in 2013. Free intermixing between two sexes is largely tabooed, with most marriages being arranged by parents or relatives. Being a collectivist society by Mishra in 2010, children have a greater sense of compliance to all parental decisions. Extramarital relationships, separations, and remarriage are usually stigmatized, whereas the adherence to one's marital duty is considered to be most important. Thus, marriage is more a matter of social values, customs, and traditions in the Indian household. Being a predominantly patriarchal society, there are strict gender roles that classify men as breadwinners and women as responsible for motherhood and household duties. The prescription of marriage is more stringent for Indian women than Indian men. Religious dogmas that perceive a girl as a burden to be given away, kanyadan, evil practices of dowry, subservience towards the husband who is considered to be her god, Pati Parmeshwar, as depicted in the festivals of Tej and Karwa Chauth, together reflect an extremely biased society that positions women as a skewed end in the couple relationship. Sociologist Susan Wadley in 1991 examined the identity of a woman in folklore, myths, and legends and observed that Indian women are made to adopt contradictory roles, the nurturing roles as daughters, mothers, wives, and as daughter-in-laws, and the stereotyped role of a weak and helpless woman, thereby adding to her mental stress. However, recent trend of modern couples moving towards gender-neutral diets is an interesting observation by Isaac and Shah in 2004. Furthermore, the encountering of conflicts among the couple is usually dealt with at a family level, such that a difficulty in the sanctimonious institution like marriage is usually believed to be hidden and kept away from any professional advice. Thus, we come to understand marriages in India still grapple with issues of inequality and stereotyping. Theoretical approaches to couple counseling. With a spurt in the development of research in the area of marriage and family systems, several theoretical approaches emerged in the therapy imparted to couples, especially in the period of 1980s and 1990s. Depending on whether the couple at hand is resolved or better coping skills are taught. The several theories on couple counseling can be broadly divided into two groups, namely problem solving and acceptance based approaches. The problem solving approaches emphasize on resolving the immediate conflict at hand and reducing any kind of destructiveness that impedes the relationship. The acceptance based approaches, on the other hand, attempts to make the relationship more adaptable, healthy, and futuristic. Its purpose is to add to the strengths of both the partners and ensure the longevity of their marriage. Problem solving theoretical approaches. First, behavioral theories. These approaches are based on individual behavioral therapeutic modality that attempts to replace the maladaptive behavior by teaching the clients to learn more adaptive set of actions. This often becomes possible through the use of systematic homework assignments that induce more conscious, healthy patterns by Jacobson and Christensen in 1996 and Christensen and Jacobson in 2000. For example, observing positive signs in spouse and complimenting each other twice a day. Second, communication skills training. This is one of the most widely used intervention strategy that inevitably forms most part of almost all work with couples. Since most differences revolve around faulty communication patterns, here both the husband and the wife are taught to be listen to each other patiently, reflect each other's statements, engage in open clarifications, and adopting a sense of empathy for the other's perspective. The main idea is that partners learn to value and give space to the viewpoints and feelings of the other rather than being dismissive or confrontational. For example, both the partners may be asked to spend 15 minutes every day to turn-wise listen to the other's concern without interrupting. Third, systemic interventions. These techniques aim at identifying the nature of the interactional patterns between the couple and make them aware of their own dynamics. Here, both the partners are made to realize that the problematic behavior of one spouse is dependent on the other's behavior and vice versa. By doing so, the responsibility is equally divided among both, such that they are equally encouraged to take measures by Carr in 2009. For example, the husband's messy behavior may irritate the wife who has to engage in extra cleaning job, whereas the wife's nagging behavior may demotivate the husband to clean up. Acceptance-based theoretical approaches. Integrative couple therapy. Accepting the changes that the couple wishes to elicit in each other forms the core of this technique called as ICT. Here, partners openly recognize and suggest suitable changes they expect in each other. They are further taught to perceive these changes as differences and not as signs of strain or disturbance. Thus, an open-ended acceptance of the other calls for a greater integration and incorporation of individual differences in this form of treatment. For example, wives' wish for a more organized husband may be perceived as adjusting simple cleanliness-based habits. Emotion-focused therapy. The central idea of emotion-focused therapy, EFT, is to help the couples to develop a more sensitive understanding of each other by training them to first recognize their partner's negative or faulty behaviors, learning to listen to each other in a non-judgmental manner, encouraging the open expression of their anxieties and insecurities, confiding in and supporting each other, and gathering insights about their relationship as a whole. Thus, the partners learn to be more accommodating and approving of each other. By Johnson in 2004. Image relationship therapy. This form of therapy was proposed by Hendricks in 1988 based on psychoanalytic tenets. It primarily believes that we unconsciously choose partners who resemble the images we carry out of our parents in order to return, restore, and recover from our traumatic memories of the past. An IRT oriented counselor aims to let the partners identify their attributional patterns of projecting the negative traits of their parents onto their spouses. Thus, by making them consciously aware of this tendency, the counselor attempts to resolve marital relationships in lieu of one's childhood experiences. Gottman's couple therapy. John and Julie Gottman are renowned names in the theorizing of marriage. Based on their extensive work on conflict management, happiness, and divorce among married couples, they propose their unique form of therapy consisting of 7 levels of inputs by Gottman in 2007. A sound relationship house, they hold, must first begin with building love maps, that is, an evaluation about their knowledge of the spouse's needs, thoughts, and interests. This is followed by learning to express appreciation, respect, and fondness for each other and responding to each other's need sensitively. Role of a counselor. A therapist working with a couple who share a partnership requires certain foremost skills that must be first ascertained by the professional. Keeping the dyadic and networked nature of the marriage, the counselor must ensure the following primary roles for counseling to be effective by Gladding in 2007. It is necessary precondition for the couple counselor to have introspected, identified, and resolved any personal crisis that he/she may be facing in his or her own family or marriage. Unless the disturbing materials has not been resolved, working on another couple becomes a difficult task. The counselor must also be equipped to work in a network of people. Unlike individual counseling, the differing developmental needs of the various individuals involved need to be dealt with. Considering a multitude of factors like cultural norms, circumstantial events, thought processes, and communication differences on behalf of several members is a must. Thus, he/she should be able to attend not just two of the individuals but also cater to the needs of the relationship and the context as a whole. Another essential role of the couple counselor is to be able to maintain a precarious balance between various emerging nuisances of the marital situation. He should retain a steadiness in approaching them in a reasonable manner. Most of the above goals become achievable if the counselor is able to be structural in their work approach. This incorporates outlining the parameters of counseling, such as setting clear and constructive goals, the ways of working in the sessions, members to be interacted with, duration, and order of the sessions, etc. A successful counselor is also the one who triggers motivation on behalf of the clients. This interest and initiation by the couple is often nurtured by a sensitive and listening counselor and ensures the regularity and efficacy of the therapeutic work. Goals of couple counseling. With the establishment of several accredited bodies such as American Family Therapy Association AFTA, APA's Division 43 of Family Psychology and American Counseling Associations ACA, and International Association of Marriage and Family Counselors IAMFC, the do's and don'ts for the counselor have also been clearly charted out. What exactly does couple counseling aim at? Is the counselor responsible for holding the marriage from falling apart and making the partners stick together? Where does the margin end for this expert engaging with two partners at the same time? Let us evaluate some objectives for imparting help to couples. One of the foremost goals for the counselor is to identify faulty habits or communication patterns among the partners, which are then brought into their notice. The couples are also taught to be more open towards the emotional needs and feeling states of their partner. Instilling a greater sense of empathy and mutual understanding helps in replacing the older negative reaction patterns with a more respectful way to perceive each other's viewpoints. Another goal is the acceptance of the existence of disagreements, individuated perspective. Both the partners are taught to admit their differences instead of feeling bound by always arriving at a consensus. Expressing points of disconnect in a fair and meaningful manner is reinforced. Making both the partners turn into more fulfilled individuals in their own rights is another goal that surely aids in bringing greater freedom and growth in the marriage as a whole. It's only when each person's needs and conflicts are met fully he be ready for intimacy that largely involves sharing of oneself with the other. Recognition of the couple's sole right to stay together or separate is another lesson for the counselor. Despite the sustained efforts of the counselor to teach them better relationship coping skills, one must gracefully accept that any decisions pertaining to marriage is purely the couple's personal choice. Process of couple counseling. This stage precedes the formal meeting of the counselor and the client. Here, the professional is usually approached by the client or a family member and the problem is reported briefly. Much of the remaining work depends on what the counselor has gauged about the nature of the issue at this preliminary stage. Therefore, an observant and receptive counselor is able to pay careful attention to the information shared, manner of disclosure, signs for any power hierarchy in the dyad, hints for any cultural influences, as well as any hidden or undisclosed matters. Both the parties also schedule a suitable date and time for the appointment. It is also important to note that majority of the couples resort to professional help when the relationship is on the edge of falling apart and when they have tried all other means to salvage the relationship themselves, by Kotler and Shepard in 2008. Initial sessions. The first few sessions are considered the most formative stage in building the interactional patterns between the counselor and the clients. It is in these few sessions that a rapport is formed and the counselor familiarizes himself to the sharing partners as well as the extending relatives associated with the problem at hand. This building of trust and a working alliance is termed as a therapeutic alliance that helps the counselor to gather the perspectives of the various individuals involved. This mutual alliance can be facilitated through confirming or supporting a client's position, that is maintenance, following a sequence of events through appropriate questioning, tracking, and adopting the couple's style of communication, mimesis, by Glading in 2007. Another foremost step at this stage is getting to know the core disturbance. The presenting symptoms, complaints, communication gaps are identified by a first-hand discussion with both husband and the wife. Family dance refers to the typical manner in which a couple presents and behaves with each other. This includes both verbal and non-verbal aspects of behavior. In order to arrive at a better picture of the problem, the counselor uses the technique of framing, wherein the couple's manner of presenting the problem is noted. At various points, the counselor may ask the couple to reframe their matters or ask circular questions or probes to rule out or be sure of his own hypothetical constructs. Middle sessions. This stage of counseling lies in between the initial phase and the termination. This phase aims at bringing about suitable changes in the dyadic patterns and marital dynamics between both the partners. It is here that active implementation of therapeutic strategies is brought to the forefront by the counselor. The role of the counselor, therefore, shifts from being an observer to a supervisor or an executor. At first, the couple may often be resistant to incorporating changes, and these modifications in their behavior may be at a superficial level. For example, a husband may learn to greet her wife every morning, or wife may try to ask about the husband's time spent at office every evening. At this level, both the partners are at an early stage of learning and require consistent support, practice, motivation, and encouragement to continue their task persistently and discover any shortfalls in their own behavior. A simultaneous assessment of the situation ensures that the counselor as well as the couple remains informed about their maladaptive patterns and learn to stay focused by incorporating suitable changes. Throughout this stage, the counselor remains mentally, verbally, and behaviorally active. Friedlander, Wildman, Hetherington, and Snoron in 1994 by not just imparting cognitive training or preaching, but also placing the couple in real life situations such as interacting with other couples or other family members. The purpose, therefore, is to make a more settled and long-term change in the mutual behaviors of the couples by Marsman in 2009. These second-order changes involve alterations in pre-structure's mode of behaving. For example, the same husband may now be more warm towards the wife, and the same wife may be more patient towards the husband by making warm greetings, open emotional expressions, and time to each other a conscious and a regular part of their relationship. This stability in change is an achievement that becomes possible only when the couples regularly respond to the timely meetings and introducing efforts of the counselor. This is also the longest stage of the therapeutic work, of which application of situation-specific techniques, psychoeducation, and homework assignments are a must. Termination. Termination denotes the final closure of the therapeutic relationship. It is not fixed in terms of the respective roles of the clients or the counselor, but both have an equal openness to share their comfort levels, participation, and willingness towards bringing the treatment towards its end. A thorough assessment determines if the couple's goals have been met and if they can function on their own effectively. This is then followed by gradually building towards the termination, which is not ended abruptly. Also, a time-to-time follow-up leaves open the possibility of future interactions as help is left open and available at all times. Intervention techniques in couple counseling. Depending on the nature of problem, magnitude of the issue, role adoption of each partner, personality styles, as well as the theoretical approach used by the expert, One may make use of several strategies more actively. Many a times, the counselor may have to play the role of a teacher, supervisor, trainer, or an advisor to ensure that temperatures are not raised and that all communications take place within the parameters of a meaningful and guided counseling practice. Ethics in couple counseling. With an increase in the need for effective couple counselors in the mainstream of therapeutic psychology, emphasis on the adequate training and expertise of the professional becomes imperative, as does the close study of dynamics of a system called marriage. Effective marriage counseling has become a challenging task in today's world that is fraught with environmental stresses and cultural complexities. The counselor in the process of therapy is often confronted with a number of moral dilemmas pertaining to information that is brought to the counseling room. One must not only reconcile these ethical issues but also take into consideration when matters of mental health issues come into conflict with law, family, or one's own belief system by Rowley and MacDonald in 2001. Thus, we observe that while guidelines established by bodies on couple counseling assist the counselor to establish his role more clearly, at the same time, many of these issues demand highly specified and contextual answers with a conscious decision making gone into the process. Ethic of confidentiality. Should counselors hold secrets of one partner and not disclose it to the other? Who all is permitted access to the information shared inside the therapy room? Since the well-being of the client remains the main objective for the specialist, the material is thus only meant for supervision of professional consultation. However, in cases where one suspects any harm to the client or to others, some disclosure or action by the counselor may take place. Ethic of divided loyalties. Who does the counselor work for? Should one give priority to the family's problem or individual needs of the spouse if the two are in conflict? Does one have to be answerable to the parents, teachers, administration, workplace, etc. too? Although the betterment of the client remains the primary concern, but in extreme instances of any kind of sabotage, such as drug intake, lack of compliance, or immoral behavior, one does not take into confidence or let an external body intervene by Tolman in 1986. Ethic of labelization. Is it correct to highlight the problems of the client? How often should the counselor use technical jargon or symptomize the patient? Whereas a conscious acknowledgement of the problem at the hand is a prerequisite for designing any future intervention. However, too much technical information may scare the client away or make him feel vulnerable or worthless. Thus, one should avoid a repeated labeling but replace it with an informed evaluation of the presenting complaints. Ethic of deception and informed consent. Can one deceive or manipulate with the client even if it is for his good? Although counselors are taught and trained to be truthful and caring towards the client, always keeping his interest as primemost, however, many a times absolute frankness may do much unwanted harm to their relationship. Thus, a counselor-client relationship may be fraught with times when material may have to be withheld for the betterment of the client. Moreover, having a clear statement of agreement beforehand ensures that the clients are fully aware of the nature of therapeutic process, issues around fees, personal disclosures, access to records, as well as information about the counselor's background. Ethic of boundary violation. Is it alright to visit or accept an invitation by client's family? How to behave when you know the clients outside the clinic? Are negotiations around fees considered? Can one become friends with him? Can one develop a romantic relationship with the client? It is absolutely mandatory to charter the rules and the permitted boundaries that apply to a relationship with the client. Although one has to serve a nurturing role for others, it is equally necessary to draw a safe distance between each other by Rosenblum in 2003. Ethic of personal bias. How to keep one's own opinions and values in check when dealing with sensitive issues such as child rearing, sexuality, promiscuity, etc. Couple counseling often comprises of sharing personal issues that often compel the counselor to take a stand. It is necessary that the therapist must keep his or her own preferences and choices away from that the couple has to share. Seeking a personal resolution around by conflict from one's own life is therefore mandatory to avoid any impediment to the counseling work by Resnick in 2011. Ethic of social responsibility. Should matters around domestic violence, sexual or child abuse be reported to legal authorities? If a therapist suspects any harm being inflicted to any of the partners, then it is absolutely mandatory to report such cases to legal bodies. Certification and licensing of the counselors ensure that they are aware about the behavior risk human rights and what action be taken for their protection. Couple counseling, as we gather, is a highly nuanced therapeutic approach that has emerged into a complex branch of treatment, with special attention given to the theories of marriage, process of counseling, intervention strategies, and essential codes of conduct for a certified counselor. Imparting professional help to married couples is a skill that must be developed with due training and experience. The contextual realities of the socio-cultural rituals and practices of the ethos to which a couple belongs add to the successful dimension of couple counseling.
Summary. Marriage may be defined as a bond between man and woman that organizes the family and follows a set of moral and legal codes of adherence. A couple's relationship can be fraught with regular confrontations, emotional disconnect, poor intimacy, and concern about children. Couple counseling is a systematic approach that aims to fill the gaps in a marital relationship to ensure its longevity and happiness. Last century has witnessed profound changes in the functions, characteristics, and the stability of marriage. Emotional functions of marriage have become particularly crucial for the stability of the contemporary couple relationship. Since the 1960s, there have been dramatic changes related to gender roles and increase in women workforce participation, leading to challenges like career-oriented spouses, single-parent families, isolation among children, broken homes, and emotional crises. These changes emphasize the need and urgency towards a branch of psychological therapy called couple counseling that is aimed at dealing with relationship distress between two married couples. One of the primary objectives of couple counseling is to reorient the partners towards viewing their conflict as opportunities for personal growth. With a sudden research interest in the area of marriage and family systems, especially in the 1980s and 90s, several theoretical approaches have emerged. The problem solving approaches emphasize on resolving the immediate conflict at hand and reducing any destructiveness that impede the relationship. Problem solving theory approaches include behavioral theories, communication skills training, and systematic intervention. On the other hand, the acceptance based approaches attempt to make the relationship more adaptable, healthy, and futuristic. Acceptance based approaches include integrative couple therapy, emotional focused therapy, image relationship therapy, and couple therapy. Keeping the dyadic and networked nature of marriage, the counselor working with a couple must have the professional skills needed for dealing with it. Several accredited bodies like American Family Therapy Association, American Counseling Association, and International Association of Marriage and Family Counseling have clearly charted out the do's and don'ts as well as the aims of couple counseling. The process of counseling married couples is divided into 4 broad stages: pre-session planning, initial stage, middle sessions, and termination. Several strategies for intervention can be used depending upon the nature of the problem, magnitude of the issue, role adoption of each partner, personality style, as well as the theoretical approach used by the expert. Effective marriage counseling has become a challenging task in today's world. In the process of therapy, the counselor is often confronted with a number of moral dilemmas pertaining to the information brought to the counseling room. One must not only reconcile these ethical issues but also take those matters into consideration when mental health issues come into conflict with law, family, and one's own belief system.